Today I'll be discussing slap tears. Slap is spelled capital letters SLAP, so it stands for superior labral anterior posterior. So the slap or superior labrum is where the biceps tendon attaches inside the shoulder. So you have your biceps here. There's a tendon that actually inserts deep into the shoulder. That can be torn, and patients will come in complaining of pain deep in the shoulder and will often complain of clicking with certain motion. They'll often complain of weakness and difficulty with doing push-ups that they used to be able to do very easily. It can be caused by trauma or repetitive throwing activity, so you may have heard about baseball players getting these tears. The exam again looks at range of motion and strength, and something called O'Brien's test, which I'll be demonstrating shortly. The imaging usually is normal on x-ray because x-ray only looks at bone, and since this is a cartilage, you won't see it on x-ray. MRI with contrast is best because you inject the dye into the shoulder, expands everything so that you can clearly see the tear. The treatment in the office is usually with anti-inflammatories, cortisone injection and therapy, because sometimes these patients will respond and not have to go through surgery. And then if that fails, then repairing the labrum or something called a tenodesis, where you cut the labrum and reattach it to the bone, is what we do depending on the patient's age and the quality of their tissue. Early detection is important. So if you see any of these signs, I would recommend using over-the-counter anti-inflammatories for about 1 to 2 weeks, stretching your shoulders to see whether this resolves. And if it doesn't resolve, seek attention with an orthopedic surgeon. So if there is a full tear, please seek medical attention immediately. All right, Jonathan is going to help me demonstrate the slap tear exam. Okay, as we mentioned earlier, the slap is tearing of the cartilage, the biceps cartilage inside the shoulder. All right, so the key again is range of motion in all planes, and normally with slap tears they don't have any range of motion issues, they have good motion. So the key test in a slap tear is something called an O'Brien's test. So an O'Brien's test is I stand in front of them and I have them internally rotate their thumb, and I'm gonna have them resist me first with a thumb down and then thumb up. And then if it's more painful with a thumb down, then you know that's a slap tear or a positive O'Brien's test. So resist me, okay, good. Then I ask them turn around, resist me. So if they say that, doc, it's more painful with the thumb down, then that's a positive O'Brien's test. That's someone that I would suspect of having a slap tear, especially if they've been complaining of pain and clicking in the shoulder. So that's it. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.